My pathology is tuberculosis, or more commonly known as TB. This is an infectious disease that typically affects one's lungs. However, it can travel to other parts of the body and affect different parts as well. The two projections we will be doing today are a PA chest and a lateral chest. This is to see where the nodule is located both superiorly and inferiorly, and then also over the lateral, so you can see where the nodule is located anteriorly and posteriorly. For these chest exams, you're going to want to remove any necklaces or lanyards that the patient might have that can get in the way of the lung field.
Gel in.
After preparing your patient for the exam and using your patient identifiers, you're going to want to ask them the history and why they're here to get the exams today.
I've had a cough for about 3 weeks with mucus. Shortness of breath. Been feeling really tired for the last couple weeks.
You want to align your bucky to your tube here. Since we're doing a chest, we're going to do a 72 SID. So we're lining up to the 72 up there. And obviously you want a horizontal beam. Then you also want to make sure that you're detented transversely as well. All right, so before you position your patient, you're going to have them shielded, of course. So then once you're at 72 SID and the bucky is aligned to the tube here, you can start positioning your patient. So for a PA chest, you're going to have a patient with their chest up against the board here. And then you want to be centered at the level of about T7. So you just want some light above the shoulders here. We got our tube lined up to our bucky. I'm gonna have my patient reach around and grab the sides of the bucky here. Want to put the correct marker on the correct side. And then when I go to take the exposure, you're gonna take a breath in, blow all out. You're gonna take another deeper breath in, and then hold it until I tell you to let go.
Gel out.
And before you take your exposure, you're gonna want to shut your lead line door here. Then we're gonna walk over to the control panel where we are protected by this lead line glass, so we as a technologist do not get exposed to any unnecessary radiation. All right, once you get your patient measurement with the calipers here, you're going to go over to your book, and you're going to set your exposure factors. So our thickness lies in between these ranges. So we're going to go to our panel over here. Select 100 kVp, 18 backup mass. You want the right and left chamber selected with the large filament and the wall receptor. And for the next projection at the chest, we're going to move on to the lateral. So for this position, you're going to have the patient put their left shoulder up against their board, and you're going to have the patient bring both arms above their head if there's not a bar for them to reach onto. So we're still at the same centering point here, so not much should change at all. However, you might be able to collimate a little bit anterior to posteriorly, depending on the patient habitus. Then once again, you're going to want to mark the site of interest. Of course, the shield's still on, and then same breathing instructions here. You're going to take a deep breath in, blow it all out, take another one in, and hold it in for the exposure. For the lateral, not much changes here. After you measure your patient, you're going to come back to your exposure book. You're going to see where the thickness lies, and you're going to enter your exposure factors into the control panel. So for this, we have 100 kV, a 38 backup mass. This time we have the center chamber selected, still with the large filament, and still with the wall receptor. And of course, if you are x-raying a suspected TB patient, you're going to want to wipe down anything that they touched, including the board here. And then don't forget the back sides as well. And then if you have a bar to reach up for your lateral chest, make sure you wipe that off too.